Ketamine happens to affect glutamate transmission, which we know is important in certain parts of the brain in stress. So animals, rodents that are chronically stressed will have changes in certain part of the brain, prefrontal cortex, hippocampus. These are changed, improved with ketamine. Very exciting. The second thing is much more practical for the ordinary person who is suffering. It's safe and rapidly effective for people who haven't responded to our traditional therapies. It's particularly good for people who are suicidal, and that's wonderful. The antidepressants that we traditionally have used often take a month to work. If somebody is seriously suffering or is suicidal, that's a terrible length of time. Somebody getting intravenous ketamine feels the effects quickly, a matter of minutes to hours, and while it's not permanent, with boosters, they can do very well. The trouble is, Prozac came out, fluoxetine came out in the late 80s, and then a whole bunch of B2 drugs followed. These are all very similar. One might be a little better in terms of this side effect or that side effect, but they're all the same. Very disappointing if you're a clinician. It must be terrible if you're a patient. The idea that you now have something that's rapid acting, safe, and operating on a whole other plane of effectiveness in the brain is marvelous. It's very, very exciting. Right now, we can say intravenous ketamine is effective, useful, and safe.